I'm not getting it at all, but that's okay.
You are not? I just sent it, Em.
I wasn't getting it. Yeah.
Psst, psst, psst. Hey, did you hear about the new podcast? Hoy, what's it called? It's literally called Psst. What?
There's a new podcast out right now. It's from Fil-CHA.
Filipinx AO sharing stories together, as in the Psst podcast.
All right, welcome to another episode of the Filipinx AO Sharing Stories Together podcast. Today is June 16th, 2021, and this is our episode about Filipinx AO healthcare workers' experiences during COVID-19.
And a disclaimer, information is up to date as of today's recording / live stream on June 16th, 2021. But due to the circumstances surrounding COVID-19, information may change by the time you view this episode.
And so we are streaming on Facebook, and for folks who are joining us via Zoom, please feel free to activate the transcription, which is on the black bar, just to allow for accessibility so you can have captions on as we speak. I have it on right now, so I can see exactly what I'm saying right now in this moment. So as for Fil-CHA, so the goal of Fil-CHA, Filipinx AO Community Health Association, formerly known as the Filipinx AO COVID-19 Resource and Response Team, is to address the health disparities within our community and provide policy recommendations and resources surrounding the needs of our people. We also aspire to serve as a network for the Filipinx AO community through collaboration between Filipinx AO scholars, community organizers, leaders, researchers, social workers, public health advocates, and professionals, and clinicians and media. So as for myself, an introduction, my name is Eddie M. Gana Jr. I work at CIPA, Center of Filipino Americans. I'm a mental health counselor, so I provide family counseling to Filipino families all across LA County. I'm also a co-organizer, co-founder of Sunday Jump, an open mic series based in historic Filipino town, using arts as a space to heal and to connect with each other. And I also believe in the therapeutic expression of the arts and how it allows us to then pursue goals, pursue our dreams, using all that through spoken word. And for this episode, I am drawn to it because, like many folks, having people in my family who are who are a healthcare worker. My mom, Elizabeth Gana, is an RN in the telemetry unit for 23 years. And 33 years altogether when she first started as a unit assistant in ICU at Kaiser Permanente. And so, with the pandemic and it's been rough on all of us, and especially noting healthcare workers who are on the front lines. But enough about myself. I'm also joined here by my co-host, Alexa.
Oh, thank you, Eddie. That was a wonderful introduction. But hi, everyone. My name is Alexa. I use she, her pronouns, and I am a registered behavior technician. I also volunteer as a certified nurse assistant at a free healthcare clinic in San Francisco. I worked as a CNA during the COVID-19 pandemic, and I had patients and coworkers who suffered from COVID. Right now, I am looking forward to matriculating to Azusa Pacific University, where I will get my bachelor's in nursing and my master's in nursing as well, looking to specialize in pediatric nurse practitioner. But we are all here to listen to our guest speakers from the PNAA, Philippine Nurses Association, or of Philippine Nurses Association of America, Dr. Riza Mauricio and Emily Danuco. Dr. Riza is a nurse practitioner intensivist in pediatric critical care medicine for almost 30 years. She was inducted as a fellow of the American College of Critical Care Medicine in 2015, and she is active in several organizations such as the PNAA, where she is currently the chair of practice committee, and the Healing or Nurses Campaign Kabalikat program. She is also associated with AACN, American Association of Critical Care Nurses, as their past board of director, and she is also involved in SCCM, Society of Critical Care Medicine, as the correct chair of Quality and Safety Committee. And she is a representative to the collaboratives on environmental health. Her research interests include quality of life in children, adolescents, and young adults.
And so join with Dr. Riza, we also have here Emily Danuco. And Emily Danuco is a registered nurse, single mother, community leader who believes that caring about others more than yourself gives meaning and value to all of our lives. And also emphasizing that the life of a nurse does not end at work or at home, and that the community needs nurses, needs those on the front lines now more than ever. And so I'd like to allow now for Dr. Riza and Emily to add anything you'd like to say to folks who are tuning in for us.
Hi, everyone. Good evening. Thank you so much for coming in and attending in this podcast. We're so excited to be here with you all. And I just love your jingle, the psst. If you guys know, I'm a mom and born in the Philippines. And so that's what we do in Cebu, like psst, right? When you're calling somebody. So it's very authentic. I love it. And I love the program as well. So it's authentic Filipino. Thank you so much for starting this program.
Right, it gets our attention, right? The psst, like,
Exactly, right?
Right, definitely.
Be careful though, because sometimes I heard witchcraft does that too. The witches, they do like psst, yeah. So be careful.
I've heard about that in the province, that if you hear something like that,
yes,
then
exactly.
it might be the witches calling you.
Yeah.
Hi.
Okay. Well,
Good evening, everyone, and thank you for joining us tonight. And as Eddie had mentioned, my name is Emily Danuco. I'm the current president of PNA Northern California as well. So PNA of America have about 55 chapters, and we are divided into 4 regions, and Northern California is in the Western region. In the Western region, we have about 18 chapters. And I'm also the Circle President representative in this region. And in Northern California, we have members from San Jose to San Francisco, Daly City, and we have over 100 members or so. Thank you for having me here tonight.
Awesome.
We're national.
Being here tonight. Oh yeah, it's so great to hear that there's so many chapters of the PNAA. I'm glad to see that they're all over America. But before we begin, I'd like to take a minute for acknowledgement. A big thank you to the Association of Asian Pacific Community Health Organizations, or AAPCHO, for making this possible. Also, this podcast was partially funded with the generous support of the Walmart Foundation.
And so for this is our 4th episode of series surrounding COVID-19, following our pilot episode. This episode follows episode 3. So for folks who have joined us from the last one, that was about understanding of mental health through self-care plus community care during COVID-19, which I was also a part of. And so, we have our lineup here. We have Dr. Riza, we have Emily, we have Alexa. And so let's dive in what this episode is all about.
Yeah, so this episode addresses the personal and professional experiences that Filipinx AO healthcare workers have experienced during the COVID-19 pandemic. We will hear stories, understand the data, and recognize the impacts COVID-19 has had on healthcare workers and their families and friends. Earlier this year, Fil-CHA sent a letter to Dr. Nunez-Smith and the Health Equity Task Force through our Policy and Advocacy Committee for a call for data disaggregation. We saw that 1 in 4 Filipinx AO are frontline healthcare workers, and 1 in 3 COVID-19 deaths among nurses are Filipinxo, despite making up 4% of the nurse workforce nationally. Filipinx AO healthcare workers have been greatly affected by COVID-19, both mentally and physically.
And so with all this data together, definitely the need to have this aggregated data, and also with us, with our different experiences, our backgrounds, our insight, we do have several committees. And I do want to highlight a committee that's close to my heart, thinking about mental health. So the goal of the mental health committee, Fil-CHA, is to improve the mental health and well-being of our community through collaboration with individuals, communities, and orgs from multiple sectors focused on behavioral health. So again, just with that holistic approach, the mental health, but also the physical health. And so thinking about how COVID has impacted us all, right, during this pandemic, on the front lines, at home, with family members, with peers. I wanted to ask Dr. Riza, how has it been being a Filipinx AO frontline worker during this pandemic, emotionally, mentally, physically, and familial?
Thank you so much, Eddie. And I really truly appreciate this segment of your podcasting because, as you all know, in the whole nation, none really that totally dedicates on Filipinos and their experience, maybe a snippets of here and there, right? And like what you mentioned, the data is out there that a lot of us are in the front line, as nurses who are right at the bedside taking care of patients, nurses and nurse practitioners, some are physicians, and there are also other segments of the healthcare workers that are, transporters probably, that are taking patients here and there. So we're out in front of all this happening when the pandemic happened, started last year. And so it's very unfortunate that there is no social media that really covers us, and maybe just a few things here and there. So for me personally, as what you all know, I work as a nurse practitioner in the intensive care area. And so when COVID-19 hit, we were all scared and afraid of what's going to happen to us. And especially that when we knew that the source of contamination, transmission of the disease comes from respiratory droplet. So in the intensive care, as you all know, we do a lot of intubation where we put in, the oral airway for a person to breathe, or the bedside nurse is suctioning a patient, and that's coming from the mouth, and that's where the droplet comes. And so even though that, there were data coming in that we have to wear masks, and is it mask only? What kind of surgical mask? So that's where the fear comes from, because there's really, the science is still new in COVID-19. And so initially the guidelines keep changing, right? Because we don't know what is really the right thing to do based on that it's still a new science. And then just for protection, we said that, in the intensive care, because we are very close to the source of contamination, then we have to use the N95. And some people were even using much more than that, the poppers, that's what they call. But then because we were, the whole nation, as a nation, we were not prepared in terms of, personal protective equipment. And so there was a lot of hospitals that didn't have these PPEs ready for healthcare providers. Not only as nurses, nurse practitioners, physicians, as well as transporters, and particularly the N95. So what did we do? There was N95 were being reused. Like they would clean it up. I don't know how they were, decontaminating it. And you just have to trust them that they're doing the decontamination, because, if you imagine somebody has used it like a day prior to, because what was happening was the guideline came out that at the end of the day, we have to turn it back in. And then the hospital, decontamination unit, or the sterilization unit would decontaminate it and give it back to us. It doesn't necessarily be the one that you used the previous day, but it is something that's decontaminated that you are going to use the following day. And then aside from shortage of PPE as well, you also do not know if it's truly just droplet that you would get the COVID-19 from. And then there were a lot of discrepancies in terms of guidelines from the national, government, as well as the local government. And so the messaging was not uniform all throughout the country. So some people were masking, some were not initially, until finally we pivoted towards, the science pivoted towards saying that it is really important for all of us, such that transmission would be reduced by using a mask. And those of us that comes to the hospital, we're using the surgical mask. Of course, lay workers can just use, the cloth mask that you have. But for us in the hospitals, we're using the surgical mask. And for us that are inside and embedded in caring for COVID-19 patients, we have to use the N95, right? And so that was happening to us. That's why there was a lot of fear and anxiety that's happening. And that fear and anxiety is not only like happening for you when you are in the hospital, it happens as well when you go home. Because as you know, when you go home, just like what you said, Eddie, your mom is in the hospital. I'm sure your mom as well is also very nervous of bringing this, transmitting this disease when you go home to your family, right? So me was very, paranoid and, wanting to be clean and doesn't want my family to have, to acquire this disease. I have to be very careful in what I do. So, even just my behavior and how I dress up myself, going to work, coming back from work, making sure I decontaminate myself. I was even laughing with my friend that, maybe our lungs are full of Clorox now, just putting Clorox all the time and wiping Clorox all the time. And so there's a lot of that fear and anxiety and the things that are, unknown, a lot of unknown to us is causing a lot of, I would say, burden, emotional burden for all of us. Not only, I would say, for us that are nurses or those that are in the ICU, even those that are in non-COVID area. Because as you know, even just touching any object that other people that are infected, you can also get as well. You all know that. And then even other healthcare workers, for instance, those people that are transport, some of our Filipino workers that are not necessarily at the bedside, but are transporting patients because of the shortage of PPE. Some of them actually were not prioritized to get PPE, and that's how bad it was initially. Because there was not a lot of PPE to go around. And obviously in any institution, what they do, and gladly for me and thankfully for me, because I was in intensive care, they normally prioritize those, high acuity critical care areas, the OR, for those PPEs. And some of our healthcare workers, like those transporters, perhaps I've heard, some of them said that they were not prioritized to have one. And so it's very unfortunate that I know there's several of them transport people that got a disease, and perhaps coming from there was shortage of PPE at the beginning of this pandemic. And so that fear, anxiety, and confusion really was the predominant feeling that I have, and in a lot of Filipinos as well that I know of. And I don't know if you want me to go into the survey that we did for Filipino nurses, so that you know the information that that came out of that survey in terms of how they were feeling as well. I can share that with you.
Oh, definitely. The data there is important, and just to highlight and to acknowledge. So talking about the supply, the shortages that were happening, feeling afraid, paranoid, nervous, right at the start of the pandemic, not sure like what is going on. Trying to make sense of it all, because in what we don't know, then there's a lot of ways that things can either go south, or things can become worse, or whatnot. So there's a lot of that figuring out from what I'm hearing, and so like that then leads into this overall stress, right?
Mm-hmm.
Overwhelming stress, this community stress. And so I wanted to also have Emily to also share about her experiences as a frontline worker. And then, yes, and definitely we can go into the data, Dr. Riza. But Emily, I'd like if you could please share.
Thank you, Eddie. And thank you for that, Dr. Mauricio. So for me, I don't work directly at the bedside. I work as a coordinator, an RN coordinator in an outpatient setting. So we see patients in clinic. So it's a little bit different, but it's the same emotion. We were so afraid, and it was chaotic because there wasn't, even our own clinic was getting the information from CDC, and things were changing like every day. And in the clinic, we don't have N95, for example, or we have surgical masks. and our clinic belongs to a bigger organization next to the hospital. So we were still getting our supply from the hospital, but the priority, of course, were the hospital staff and the clinic staff. We would get the surgical mask. But since we were seeing patients, more than hundreds of patients a day, our staff, the first exposure is the receptionist, of course, right? So they greet the patients, and since everything they were saying that it was droplet, it could even be airborne. So even the staff in the front desk was really scared of, they were the first contact. They don't know if these people coming in would have the virus, and initially they were not wearing masks. We were not, it was just saying that the mask would be for the bedside staff. So in the beginning, we were not masking, and we didn't even have the mask yet. But anyway, those are the first contact, the receptionist, and then the patients will be checked in, and then the MA will be the second contact. They get the vital signs and they put the patient in a room, and then they would call if the patient is seeing the nurse or social worker or financial person. Then these are more people coming in, getting in contact with a patient that we don't know if they have COVID, and then they would see the doctor. But so in the beginning, it was very scary for everyone, and they're getting, they want more information about how they can protect themselves. Were we even supposed to see the patient, or do we just limit contact and it will just be the doctor or the nurse and not get everybody exposed? So it was just a lot of uncertainty, and our staff was scared that they get exposed and they also bring it home, just like the nurses and the doctors. But it got better. Like I said, the hospital staff were priority, the clinic were second priority. So we were getting the surgical mask, and then eventually everybody needed the mask. And then they would it came to a point that there was temperature check already before patients come in, so they would be stopped at the elevator. But that was already kind of third week. Then they would be stopped at the elevator, including us actually coming in. So they had stationed our company. The good thing about their organization is they also created a command center, right? And all departments, all the head of the department needs to go into that command center to disseminate all the practices, the best practices. So all the clinics needed to stop patients in the elevator area and get the temperature check before they move on, and everybody was already masked. And eventually they even put that little shield in front of the front desk. So but yeah, in the beginning it was a lot of fear and worry that you would bring it home or you get sick. And we definitely had staff that got sick from COVID. And so it was emotionally difficult. We eventually were able to work remotely. Most of the staff, there's still staff that needed to be on site, but I think majority of the staff were able to work remotely, I think a month into that, into the pandemic, when they locked down. When they started lockdown, then most of the staff was able to work remotely. But yeah, I think it's important to definitely share the data that we have with Philippine Nurses Association. I work with Dr. Mauricio with the Kabalikat program, and we send that survey out. So she definitely can share that, and we'll be able to hear more about how the nurses felt and the people that responded to the survey. She has more data on that. But thank you for listening.
Yes, thank you so much for sharing all of your stories surrounding when the pandemic first hit. I was wondering, I know healthcare workers specifically have been hit hard by COVID-19, but how has it been for your family when the pandemic first started and having to adjust to that?
For me, I am lucky that I didn't have any family that got sick, but it was difficult because I have a student. I have a college student that was in another state. So I didn't know when they were going to be, they were not locked down yet in that state. So they were still on site, and then eventually they were sent home. But in the beginning, they were still there. So I was worrying about what's going to happen to him. And they certainly did not have any precaution. The school, just like everybody else, was overwhelmed with what needed to happen. When do they have to have the kids stay in the dorm, or they come, so it was just a lot of uncertainty and unclear direction of how they can continue to teach and continue the college education with the current situation and the pandemic. So eventually he was able to come home, but that was another side of the difficulty with a college student. Being home away from friends was, I think, the most devastating part for them.
Thank
And
you
how
so
about
much.
for you, Dr. Reese? Oh, sorry.
Sorry, Eddie, go ahead.
Sorry. Oh, and how about for you, Dr. Reese? And thank you, Emily, for sharing how it's affected your own family members. How about for you?
So for me, Eddie, it was so nerve-wracking because we were planning my daughter's wedding the entire year last year, and then COVID hit. So supposedly lots of families were coming to Texas. And so with that, we have to chop it down to a very small people and excluded all the old folks, because as you know, initially they said, oh my God, it's going to be the old people that will be hit by this pandemic. And there were lots of deaths coming from the nursing home, if you guys remember that, in New York area. So they were excluded from that wedding, except, just the bride and the groom's parents, right? And the rest were the millennials, because we thought the millennials will be stronger and will not get hurt by this pandemic, which actually was wrong. But initially that was the data. And so that was happening to my family. And the other thing to it is also a lot of my family are in the healthcare workers. And so lots of them were in the New York, New Jersey area that was badly hit from the very beginning. So I really was very worried with them. There were physical therapists. I have my nieces and nephews that were going home to home because they had to do like home care work. And so I was nervous for them. And you know how it is from transmission of when you don your PPE and when you undo it, that's the place that's, you're in a precarious position, because in the process of doing it, you can potentially, contaminate others or your supplies or what have you that you're bringing. So me, that again has this like paranoia in me, that I always like call them and remind them, remember what to do when you're putting in your gloves, just the proper donning and doffing of those PPEs. I have to remind them, and including friends as well, because as you all know, Filipinos are not only nurses. There are physical therapists, occupational therapists, right? Transporters that I mentioned to you. So a lot of us are in the healthcare workers and physicians as well. And so a lot of reminders at the beginning until you get used to it. Because if you guys know, Alexa, probably you know this one, because you're a nursing student, but the donning and doffing requires a technique. So if you're not used to it, the potential for contamination is there. You as an intensive care, right? Or in areas that you do a lot of these communicable diseases, you are skillful in doing that. So in a lot of institutions, there were actually teaching nurses, reorienting them on how to do this such that you prevent further spread of the infection if you are taking care of these patients, including not only those that were diagnosed with COVID, but those as well that have PUIs, or those that are unknown yet, where you're waiting for the diagnostics to come in. And you all know also from news that a lot of the diagnostic tests that we have initially were not sensitive to it. So that added again another anxiety, another burden to our healthcare workers, just the emotions that you have. And to bring this home, I am so lucky that my family, my husband, and my son is so very supportive of me and understand what's happening. And actually, my son also, who was studying then in London, has to come home. And I'm glad that he was home already for the wedding. And so we told him not to go back, because if he was in London and we were here, and you know how London was badly hit as well with the pandemic, my mind would probably be just, crazy, just be thinking about that, right? Especially that, that things that are not within your control is really very difficult to just imagine and think about. And I'm so glad that we have gotten used to practices of, safety, hand washing, for instance, and for one, right? Because we all know that hand washing really prevents spread of infection. So myself, I have to teach my husband, like one-on-one, like how to do this and how long you have to do it. And I told him, you have to sing happy birthday, and don't sing it fast. You just have to sing happy birthday while you're washing your hands. And you guys probably have known this from your parents. That's the effective way of washing your hands, so to prevent the spread of the disease. That's fundamental.
That's funny that you brought that up. I actually did that a couple of times. Actually, yeah, anytime I can wash my hands, I like saying happy birthday.
Yeah.
Happy birthday to you. Yeah.
Exactly. And I told my husband,
every day is like my birthday.
So every day is everybody's birthday, right? So that's how you are affected. And then as the days, months rolled on, the Philippines initially, if you recall, the Philippines, their cases were low until towards the end of the year, right? And so, because I was worried too with my family out there, because I have brothers and sisters and my cousins were out there. And in fact, I lose one of my cousin from COVID.
Oh, sorry.
Yeah. He was a physician. Yeah. And they practice everything that you need to do, to prevent the spread of infection, but still it has happened. But I also wanted to highlight as well that when you are taking care of people, let's not also forget the people that you care of that doesn't have COVID as the diagnosis. Because when you are in the hospital during the height of it, us, for instance, in the pediatric intensive care and in the pediatric units, we are only allowing one parent to be there. And in a lot of the patients that are adult, they are not allowing anyone at all. So if you imagine to have a family friend or a family that's admitted, COVID or non-COVID, so that means they are in the hospital by themselves, right? And gladly for me, even me, if we allow one family to be there, so a lot of deaths are happening in the intensive care, as you know that, because they're critically ill, they have life-threatening, illness. And so when somebody dies, it's the mom that's only there with the patient. And that is just really so sad, and it breaks your heart.
That's
so you become very close to these families. I mean, if you were close to them when everybody was there, when the whole community was there, more so now, because you're the only one that they can lean on. So that's how our healthcare workers, our nurses, that's how we are taking care of these patients. So if you are a nurse and you run empty, I don't know how much you can give out to other people. And so that's why, PNAA have this great program from the very start. So Eddie, I'm just going to go to segue on this one about the project that we did with PNAA, if that's okay, right? So, I am so grateful for PNAA, the Filipino Nurses of America, because we have thought leaders. So the past president, Madeline Yu, and Dr. Mary Joy Dia, the current president. So they conceived of this idea when the pandemic started to start a COVID task force, right? And so they put all the talented people of Filipino nurses, and they put them all together. That's currently chaired by Dr. Jenny Aying. And so we developed like different phases of program as we walk through the pandemic. So phase one obviously has to deal with the things Emily and I mentioned to you about the lack of PPEs and what we can do to support our nurses. So the overarching goal is really supporting our nurses in our community. So that was the first one, the protective equipments, right? And phase two to that was the idea of supporting our nurses in terms of health and wellness, including mental health. Eddie, credit to you. I know this is your area of your niche, right?
Yes.
And so what we did, and so Emily is in the task force as well. And also she's in my team for the Kabalikat program. So just to anchor our thoughts is, so that's where I came in, because that task force, I was assigned, my team was charged to develop a program such that we can educate our nurses and how to keep our minds like really alive and well, right? With all the burden that's on our shoulder because of this pandemic. That's disease that's so new that a lot of people doesn't know, including those people that are really hardcore scientists, right? And so that was my charge. So I put together people like Emily, who's so active and responsible and accountable. So we develop a program. And one of that is the survey that Emily and I were talking about. And what is in that survey was so interesting. So what we did is, because we were charged to develop a program to support the mental health and wellness of our nurses, we said, what about let's start with having a survey. So the survey, we titled it Emotions Behind the Mask, because all of us are masking now. So we don't know, how people are feeling, what's the burden inside you. And the result of that survey is so amazing. And obviously, as in any survey that's done out there, a lot of people that answered were usually to the 40, 75 years of age, right? And among those people that were surveyed, a lot of them, most of them that answered were people, nurses that were in the acute care, critical care area, or in other words, those that are in direct contact with people, with patients, COVID and non-COVID. So then that would tell us that really a lot of our nurses are front and center of this pandemic. And no wonder why you said, Alexa, at the beginning, that from that data, there's a lot of nurses that died from this pandemic.
Yeah.
And then most of them as well, most of the nurses also said that almost actually 70% of the nurses that answered the survey, that they have family or friends that contracted the disease. So we are just, I don't know, with the blessings of God, that I know there's a lot of death in the United States and there's a lot of frontline workers that died. But you can just imagine the burden that you have when you yourself, you're a healthcare worker, you're going to work and you have to work, because then, who's going to take care of the patients? And in addition to that, one of your family members is sick. And the worst is a lot of them perhaps died, because they also said, although, a small percentage only said that, but that they, more than 5 people that they know of died of COVID. I mean, you can just imagine that, the amount of suffering that we, has to endure because of this pandemic. The good thing about is, though, that with that survey as well, you can tell that how resilient we are as nurses. I don't know, perhaps from based because of our culture, perhaps that is, because even though that we face every day people that are dying or in their deathbed, and people that are very sick, someone that's out there that you're taking care of that doesn't have a family member, that you become now their family, like your other family. And even though that, you are still going home and they're still saying that I am still okay and I'm still hopeful for the future. And so those are positive responses that we receive from the nurses. So you can see how resilient we are, right?
Right.
As a community.
Yeah, I mean, so definitely on the resiliency, I wanted to build on this with you, Dr. Riza. So, with that, with our people and our community, through all the challenges, the trials and tribulations, the up and down, right? The stressor after stressor after stressor. I wanted to ask you, Dr. Riza and Emily, how have you taken care of yourself during this entire time with mental health? Mental health is my niche, as Dr. Riza said. I'm interested to hear, how have you practiced that self-care? Perhaps maybe Emily, if you could share.
Mm-hmm.
Thank you, Eddie. And so definitely, I think we also did a survey in our chapter, and knowing the responses of the nurses, it helped us build what we can provide. Initially, before I answer that question, let me just with the survey result on how the nurses are feeling and what we did for them as a chapter. Definitely a lot of overwhelming and sure worry, and there were a lot of people that were asking for protective equipment. These are not, they're not working for big companies. They're probably in a nursing home, or they have their own, a lot of Filipino own a home care, or what do you call it, residential care, right? So as a chapter, we actually donated over 6,000 masks to local facilities. So so that was part of that project in response to the survey that we did in our own chapter, and it reflects the same kind of answers really from the main chapter. I mean, from the main PNAA survey, like how they dealt with the stresses. Mostly, I think we are very resilient because we do have strong faith. And I think there was a lot of answers about they dealt by going to virtual support group, virtual prayer. So our chapter, we started doing that. We had a rosary novena every night since March 28, 2020. And that actually, for me personally, I think that's how I took care of myself, because I was overwhelmed. I was worrying about my son. I was worrying about work. And so I think that's how I dealt with it. And I wasn't a very religious person to begin with, but I have faith, but I wasn't the type that goes to church every day or even go to church every Sunday. I was more like a Christmas, Easter, that kind of Catholic. But I think it really helped me. Our chapter have, like I said, started this prayer group, and it became a national PNA kind of prayer warrior group. We prayed for the frontliners, and we still do that every night until now, and it definitely helped me. I also talking about my family. My father passed away in February this year, and I think this wouldn't have happened if it wasn't because of the pandemic. He didn't die of COVID, but there was so much delay, and he was in the Philippines. There was so much delay in his care that I have to literally watch him die in front of me by FaceTime, by Facebook, because I was trying to get him help. And I couldn't get him help because people were afraid to go to his house to help him. The hospital, the local hospital, they come from a very small town. They were being told that if we're not sure that he has COVID, we don't have the equipment, we don't have the ability to care for him. So he just basically will just die from home if they were, so they were told, go to this general hospital and that's where you can get if he has COVID. But he had a stroke many years ago, but he basically just had an aspiration. He had an aspiration because he had a stroke, so his swallowing is weak. So because he was coughing and he was febrile from the aspiration, they thought it was COVID. So, but yeah, if it wasn't the pandemic, he would have gotten to the hospital, he would have intubated, they would have suctioned him, and he would have been fine. But because of the COVID, there was over 4 hours of trying to get him to the hospital. When he got there, he was basically already dying, and they wanted to test him first before he can get into the hospital. So he was actually literally outside the door, put on a little gurney, and and waiting for the COVID test result. So an hour later, he got into the hospital. He was negative, but it was already too late, but yeah, so that was the effects of COVID, not because he had COVID, but there was so much delay in care because people they didn't have the resources, and especially the small town in the Philippines where we're from, they were not equipped. They didn't have the equipment. So this was a traumatic experience for me. So I did take some time off from work because I think emotionally I didn't have any more to give because I was so empty and it was so traumatizing having to watch your family member die in front of you, and knowing that intubating him would have saved him, but that didn't happen, and so he ended up dying. But so I think my is to take care of yourself. Definitely is go into your faith, get the support from other people, and take the time off if you need it. Because if you're empty, you don't have anything to. You're not going to be able to care for others if you don't have it. You're broken basically. So I think for people that have gone through traumatizing events, not just for me, but nurses that are at the bedside that were seeing deaths after deaths after deaths every night, it just I think no matter how much we love nursing, and we're not robots, right? We are not machine. We emotionally get, it can become very difficult. So I think people needed to realize that, my colleagues needed to realize that if they come to the point that it's just difficult, they need to take some time off. And I have taken the time off, but I'm back to work now. But yeah, it's important that people take the time off to take care of themselves so they can continue to care for others and continue to care for the patients.
Thank you so
Emily.
much for sharing that, Emily. I'm so sorry for your loss. It's
Thank you.
so heartbreaking to hear how much this pandemic has really hurt everyone in all sorts of ways. I'm just sorry, at a loss of words. I'm so sorry that that happened, and I'm happy that you're back at work, and I hope the recovery has been going well. But those who are not healthcare workers, how can they support their family or friends who are healthcare workers who are going through these very traumatic experiences right now?
I'll start, Dr. Mauricio.
Sure.
Thank you, Alexa. I think for everyone to support healthcare workers, it definitely is to start with maintaining their mask and also getting their vaccines. Definitely, the vaccine is to help prevent any more deaths. So that's how you can help the healthcare workers, by preventing that, so healthcare workers doesn't have to have these traumatizing experience every day of having to have deal with deaths from COVID. It's been over a year, and for them to continue to experience that, I think every death that the nurses experience takes a little piece out of them. So we need to help them not have to deal with that anymore. And the one thing you can do is get your vaccines, and also definitely, if you see a nurse, you don't know what their night have been through, they may have been working 8-12 hours trying to prevent somebody from dying, or already have been comforting a family member who had lost that patient. So when you see someone coming home from work and they just look so defeated, just say thank you and tell them to to take care of themselves, and definitely support them, that acknowledge of the work that they do. It's a job. I know people would say it's a job, that's why you chose that profession, but like I said, these are human beings. It takes, like I said, every death that they experience takes a piece of them. So it's important that you acknowledge that, and we need them to continue to work and to be there for us when we go into the hospital. So I think we help them by supporting and acknowledging what they've been through, how hard their night must have been. So yeah, you see those workers when they come home from work and they look so defeated. Just say thank you and take care of yourself. Thank you.
And Dr. Mauricio, do you have anything to add?
Yeah, there's definitely a lot of ways that our non-healthcare workers can help those of us that are, front and center of this pandemic. Volunteerism is is very important. Giving people whether Meals on Wheels. And for the healthcare workers, I know there's a website out there that you can log on and, express your gratitude for what they have done, because even those simple words can really mean a lot to us. And I think, to me, the two most important thing I would like everybody, healthcare and non-healthcare workers, is to be kind to everyone, because you just don't know that as you're lining perhaps, Walmart or HEB or what have you, what kind of grocery store that you have a healthcare worker there that was just burned down, cup empty already from taking care of this patient, and somebody died in one of their families or friend. And then why would you be so rude to them? So, just be kind and be grateful for what we have, because, that is really the most important thing. At the end of the day, is our relationship with people that is very important, as opposed to fighting one another, right? And the second one is vaccination. I am so happy and I'm so proud of the Filipino nurses, because according to the latest survey of the American Nurses Association, about 93% of Filipino nurses are vaccinated. So hooray for that one, right? 90% have double 2 doses already, and about the remaining 3% has 1 dose, but hopefully they will have their second dose. But unfortunately, there's a portion of us, about 6%, who still have that vaccination hesitancy. And I am hoping that they will be converts later on, that they are just like slow adapters, that eventually they will be converted and have themselves vaccinated, because we don't know. I mean, we know that there are still variants out there. This virus keeps morphing into a stronger one and more virulent one. And hopefully this fall is not bad for us, but what if it will be? And there are still a lot of people that are unvaccinated. We haven't reached our herd immunity. I think as of today, the last data that I had, there's about just 40, close to 50% of us in the whole nation that have the 2 doses of the vaccine. And thanks to Vermont, the state of Vermont, they have like close to 70% now that they are vaccinated, and 2 doses about 63%. So they're the best in the country. Hopefully, my state would be the same, but it's still not. So I'm hoping that people out there that are listening to this podcast, and again, thank you for doing this podcast, because this is very important topic. And for those of you that are non-panelists and are listening to us on FB, Instagram, or Twitter, please have yourself vaccinated if you haven't been, because it is really very important. I know there are people out there that are hesitant in having that vaccine for whatever reason, whether it's just, I don't have transportation, convenience to it, or complacency, or distrust, or, what have you, because it's a new science. But just think about it. Think about us that are in the front line, that what if another surge would come? We are already like suffering and burdened with this one. And I'm sure we will all still continue no matter what happens, because that is the commitment that we have to our people, to the community, that we are going to do it. That's the oath that we took as nurses, right? But, that's the help that we want to do. And so I would really ask, you all and everyone to be mindful and just have that responsibility, that helping one another is the most important thing that we can do in this earth.
Thank you so much for your wisdom, Dr. Riza, and also Emily for your insight, for your story. I truly feel that even though that we are, quote unquote, resilient people, that's very important for us to recognize that we are not machines, that we are feelings, that we are ideas. And it's important that we focus on our self-care just for that longer run, right? It's not a sprint, it's more so a marathon as we go through life, as no matter what life throws at us, and to take our time when needed, and together as a community, as a people, whatever country, in the Philippines and in the US, to stay connected through relationships, to utilize resources, to follow the guidelines as it may, get vaccinated when those are available. I know that there are certain inequities when it goes to different countries with regards to vaccines, and just to acknowledge that here in the States that we are privileged in that way to have vaccines. And so for folks who aren't vaccinated, please, yes, do get vaccinated, and together let's continue to move forward with this progress as we try to get into some sense of normalcy again. If we can even obtain that, because, you know, through the pandemic that there is trauma for us and we're all working through it. But it's important for us to go at our own pace, you know, to look out for ourselves and look out for each other. So, you know, we covered a lot of information here. Actually, we did have some Zoom chat questions, but I feel that you mostly covered it, you know, in terms of the COVID-19 vaccine, folks that may have hesitations regarding it. So I wanted to allow this time, for the time we have remaining, is for Emily and Dr. Riza for 3 main takeaways that you would like for folks to leave after listening to today's episode.
So I just want people to know that, you know, everything that we have talked about, sharing our stories with you, because we wanted you to know that all of us, because even though we are all Filipinos, we have varied experiences wherever we are. And usually that's because, you know, what's in our heart is the authentic way of saying things, and what's in our heart differs, right, from each one of us, even though we have the same culture and values. At the same time, we also want you to know of what are the insights that the Filipino Nurses Association has really provided to all the Filipino nurses, things that to help and support them, whether through physical means, by PPE to protect them from getting the COVID-19 virus and the disease, as well as to improve the mental health and wellness of Filipinos. So that's the 2 takeaways that I can share with you.
And Emily?
Emily?
Yes, thank you, Dr. Mauricio, and thank you, Eddie. And thank you, Alexa, and everyone in this Fil-CHA and this podcast. So I just wanted everyone to know, whoever's listening, and if you know of anyone that's going through a tough time, whether they're healthcare worker or just family members, there are resources, definitely, and reach out. I know a lot of us don't like to talk about emotion. I think that's a cultural thing. It's like if someone wants to talk about their emotion, you would be, let's just talk about something happy. I think that's a common thing among Filipino. They don't seek medical or psychiatric help or mental health, mental support. But there, for Philippine Nurses Association, we have a program called Resilient Options. So that's offered to our members initially, but eventually I think we're gonna open that up. But right now for members, there is a Resilient Option, and that would be a training for health, you know, for mental resiliency and mental wellness. And we have peer-to-peer support group as well. Like I said, we have about 55 chapters, and a lot of chapters have offered webinars, have offered you know, the prayer group, the peer-to-peer support. They even have done Zumba, anything that would kind of help our nurses deal with the emotions they're having, or they just needed a break from work or needing a break from worrying about everything. There's resources out there, and Philippine Nurses Association have definitely done a tremendous job of offering those kind of things. So if you're not a member, and you know, some of these programs are open to non-members, so just reach out to a chapter. There's chapters in Northern California. You know, you can go to our website, mypna.org, and you can search for chapters there and region, and just reach out and find out what resources we have. And Fil-CHA definitely have resources as well and programs. So if you're going through and you're having a hard time dealing with the pandemic, and just reach out. We're here for each other, and that's what the main takeaway. Be kind to one another, and reach out if you need help.
Togetherness, connection, that
Yes.
idea of kapwa, right? Bringing us
Yes.
all together, no matter where you're located at, East Coast, Midwest, out of the country. Thank you so much for sharing those resources, Emily. And also thank you again, Dr. Riza, for you both, for the knowledge, for your insight. There's definitely a lot here covered, folks. If you happen to join us a bit late, you can be sure to catch the recording of this. It is available. And so just want to, again, show my deep appreciation to Dr. Riza and Emily. Thank you so much for your time and energy through everything that's been going on. Thank you so much.
And I just have to say, Eddie, as Filipinos, remember, that's what, I don't know if you know kabalikat, that's helping one another shoulder to shoulder. That's why we coined the term, and we use that term to support one another through our wellness program. It's kabalikat. So that's all of us actually in our community as well. Kabalikat will be helping one another through psst. I can never say that. Yeah, right?
To get attention,
exactly. Hey. Yeah, exactly.
For sure. So again, yes, thank you so much. So this here concludes our fourth episode. Please stay tuned for episode 5, which will deal with about COVID-19 effects on the Filipinx AO LGBTQI plus community. It is June, it is Pride Month, and so that will be on June 26, 2021, obviously, and it will be at 1 o'clock Pacific time.
Yes, and please be sure to follow us on our social media accounts. It's at Fil-XAO_CHA, and like us on Facebook. That's facebook.com/Fil-XAO_CHA. I actually run all of the social media accounts, so it'd be great if you'd like to collaborate with us. And if you're interested in involved or learning more, please take a look at all of our other projects our committees are working on. Actually, tomorrow, our very own Dr. Joyce Javier will be giving a pediatric grand rounds presentation describing the story behind the Filipino Family Health Initiative. It is tomorrow morning, June 17th. It will be 5 a.m. Pacific Standard, 7:30 a.m. Central, and 8:30 a.m. Eastern, and I'll drop the link in the chat below. And Dr. Riza and Emily, where can our listeners find you if they want to get connected to you?
I have a Twitter at RVMAU, and also our website that Emily mentioned, mypnaa.org.
Yeah, and I have Facebook too, but I think best to search us in mypna.org. So they can see the resources.
And follow me at Twitter at RVMao, because I posted your psst as well.
I know it's all about connection, right?
Yes.
In person, also social media, online, the interwebs.
Yeah.
Right?
Yes, where can our viewers find you? Sorry, did I cut off? Where could our viewers find you, Eddie? Online.
Me?
Yeah.
Oh, so sorry. Yeah, you got cut out.
I'm so sorry. It's probably my internet.
Well, you can stay connected with the work that I do through SIPA, Search and Involve Filipino Americans. You can follow social media at SIPA Cares, SIPA Cares, as talking about caring about each other, caring about our community. So at SIPA Cares. And yeah, we'll stay connected that way. And I'll be on another episode later on this series. So yes.
Yeah, I can't wait. That's going to be so exciting. Well, thank you, everyone. This wraps up our episode. Have a great night. Bye.
Take care.
Bye.
Thank you. Good night, everybody.
Thank you. Good night, everyone.
Bye. Good night.
Bye.